Hello, my name is Sophie. When I grow up, I want to be a pediatrician. I've always loved kids, and having a career that helps them will be very rewarding. Pediatricians are blessed with the means and opportunity to connect with children and their families, and help them live long and healthy lives. Although pediatricians have to sacrifice a lot of time to do their job, I believe it's worth it.
Was it a one, a two, a ray? Good, yeah, all right. Is it a one, a two, a ray? Good, yeah. Okay. Bend it, it's a bend it. We need tissues. All right, let's get your Band-Aid. Hold on to that. Good. We'll get your Band-Aids. Let's say.
According to pay scale, on average, pediatricians make $140,000 a year. This is definitely a pro to becoming a doctor. However, many pediatricians work nights and weekends, with a large amount of added pressure since the lives of children are in their hands. According to Cron, the amount of lawsuits for medical malpractice has increased exponentially in the 21st century. This is also a reason that there is so much pressure for pediatricians. These doctors are also faced with the conflict of doing what the parent thinks is right or what the doctor thinks is right. Parents can sometimes get in the way or slow down the process of treatment of their children, which can cause a lot of conflict when dealing with young patients. According to Survivor Pediatrics, the average pediatrician starts their day early, around 5 or 6 in the morning, arriving at the hospital at around 7 or 8 in the morning. They do morning rounds and then begin to meet with patients who had appointments. Doctors will be at the hospital until around 5 or 6 p.m., depending on how the days go. Even after pediatricians return home, there is still paperwork and phone calls that need to be made, as well as making time for family and downtime. Some remain on call and may have to return to the hospital in the event of an emergency or shortage of doctors. According to the Virtual Pediatric Hospital, in order to become a pediatrician, one must earn a bachelor's degree, attend 4 years of medical school, and complete 3 years of residency or internship. The average acceptance rate to medical school is approximately 42%. If you wish to specialize in a certain area of pediatrics, additional school may be required. Doctors must also pass their boards to begin medical work. It has come to my attention that many doctors struggle with the decision whether or not to work at a hospital or in a private practice. According to Physician's Practice, working in a private practice can be stressful since not only are you worrying about your patients, but you also have to worry about rent and the well-being of the company. However, it can also be nice since you often have access to new technology, which can further your medical knowledge and credibility as a doctor. Currently, there is a big debate going on about whether or not to vaccinate children. This may clash with my beliefs since I'm against most vaccinations. However, the article, The Pediatrician's Dilemma, points out the emotional, financial, and legal responsibilities of a parent to vaccinate their children. If a child gets sick with a disease they should have been vaccinated against, the parents could be sued for child abuse, since they didn't protect their child from that disease. Also, it could cost thousands of dollars in medical bills and emotional trauma for the child and family, along with possible irreversible physical ailments. The doctors in the article all agree that children should be vaccinated, and there are minimal risks to doing so. All in all, becoming a pediatrician will be very rewarding, despite the stress and long work hours. Being able to connect with children and make a difference in their lives and their families' lives will be an incredible life experience.